Patients of COPD suffer from shortness of breath while performing activities of daily living. This shortness of breath is a scary feeling, so you as a patient are going to avoid these activities. In time, you're going to become more and more inactive. The consequence of inactivity is a decrease in exercise capacity and in muscle force. A decreased exercise capacity and muscle force will lead to an increase in shortness of breath. So we get a vicious cycle of shortness of breath, inactivity, and a decreased exercise capacity. And you will feel overall more problems and a decreased quality of life. Pulmonary rehabilitation is going to tackle this vicious cycle. By increasing your exercise capacity, the shortness of breath will decrease and you will be able to perform more activities. Pulmonary rehabilitation always starts with an assessment. We as physiotherapists perform measurements. We measure exercise capacity and muscle force, and we make an individualized training schedule for you as the patient. To keep this training acceptable for you as a patient, we work with interval training. So these are little blocks of exercises with some resting periods in between. On top of this training schedule, we have a multidisciplinary team. A social worker will evaluate your needs to support in daily life. For example, transportation to hospital appointments, meal delivery services, and so on. We also know that people living with a long-term health condition are more likely to experience depression and anxiety. That's why a psychologist is also part of our team. A dietitian is here to guide you towards a healthy weight. The occupational therapist teaches you skills to make daily tasks more feasible. And finally, our nurse teaches correct inhalation technique. At the end of the program, you will experience less dyspnea, less breathlessness, and you will notice that you're able to perform our activities of daily living. For example, walking, climbing stairs, household activities will go much better as before. So all this will positively influence your social life and your overall quality of life.